Bone program was started in 2009 by the American Orthopedic Association, and we joined that program in February of 2015. It is a quality improvement program that assists facilities with support, education, and the tools needed to run a successful program. The purpose is to identify patients who are at risk for fragility, fractures, and osteoporosis, and we do that through education. It is a team approach that starts with a team leader, and that is our director, Michelle White. It also involves a coordinator, which is myself, the nursing staff who does a lot of the education, and then a champion physician. And for Nanticoke, that is our rheumatology doctors. Osteoporosis is a silent condition that is often not realized until after a fracture happens. It's often a result of a fall, and 95% of hip fractures are caused by falls. Falls result in more than 2.5 million injuries per year, and 1 out of every 3 Americans that are 65 or older fall each year. According to the National Osteoporosis Foundation, up to 50% of all women and 25% of all men over the age of 50 will have a fragility fracture at some point, and that's a broken bone. Studies have shown that this age population who sustain a fragility fracture are 2 to 4 times more likely to sustain another fracture. These patients may have osteoporosis or low bone density, which puts them at a higher risk for a future fracture. The Own the Bone program at Nanticoke starts on admission with identifying a patient with a fragility fracture. Then there's an automatic consult that goes to our rheumatology doctors, who then come to see the patient, evaluate, and determine if their fracture is related to possible osteoporosis. At that point, our nurses step in and start education. The patient is given education by written materials in a folder such as this, as well as video information on osteoporosis. After that education has happened, the patient is invited to the Own the Bone program. The patient has to sign a written consent, and once that happens, I can then enter their information in a national web-based registry with reporting and benchmarking capabilities. Our rheumatology doctors also send their recommendations to the patient's primary care physician so that the patient can then be followed up by either the rheumatologist or their primary care physician for further treatment options and testing. The goal is to prevent future fractures. Nanticoke is one of over 200 healthcare institutions nationwide that participate in the Own the Bone program. We are proud to announce that we have just received an Own the Bone Star Performer designation, and we have been recognized in the U.S. News Best Hospital magazine. This means we achieve 75% compliance with at least 5 of the 10 Own the Bone prevention measures, such as educational fall prevention, physical activity, limiting alcohol consumption, quitting smoking, and treatment recommendations. We have enrolled 40 patients in our Own the Bone program since we started in February of 2015, which means that 40 people in our community have been given the tools to better manage their own health. If you'd like more information about our Own the Bone program, please contact myself or my director, Michelle White, at 302-629-6611, extension 5103 or extension 5105, or you can visit our website at www.nanticoke.org/ortho.